I'm Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my client has had several traumas and is having some neck pain and headache. And I've done a mobility evaluation segment by segment through her entire neck and made sure the first rib was moving well, T1 was moving well. This is an anatomical model of the head and upper cervical vertebrae, a very large model, okay? And so this is the first vertebrae of the neck, and this is the second vertebrae. And here is the mastoid process. And I've tested side glide, contacting the transverse process of C1. I've tested lifting up and lifting up on C2 as well. And then I've come up, that was midline, and then I come on each side and lift up and test rotation. That is all good. I come onto the mastoid and I test rotation, springing it gently through a very small range of motion. And then I lift up on the mastoid, and that's where we find a restriction. I'm sure the camera, doesn't matter what side I put it on, it's not going to, capture the subtle movement because it's a very small motion. But I come underneath the ear. Right beneath it is that mastoid process, a distinct bump. Okay, so I'm on the head, all right, and I put my thumb on in the front of the mastoid process and I can gently spring it. And that's the very first joint to move, and it has good mobility. And then I spring obliquely at a 45-degree angle infralaterally, and that has good mobility on both sides. Now when I come underneath it and then I lift up towards her ear, then I'm testing side bending, and there's a very subtle amount of movement through that joint in side bending. And all motions are normal except on the right side when I lift up on the mastoid process, there's no movement there. So maybe through the nervous system, through muscle, maybe that's what's holding the neck in the side bending position, restricting movement through the occipito-atlantal joint. That's the joint where the head joins the first cervical vertebrae. The first vertebrae is called the atlas. So the occiput and the atlas joint has a lack of side bending to the left when I lift up. So my treatment is very straightforward. I contact the head, but I contact in front of the ears. That's very important because the upper two joints, where the head connects to the neck, and the C1, C2 joint are in the front of the neck, whereas the other facets are in the back of the neck. So if I want to affect the upper first joint or second joint, then my contact needs to be in front of those joints and therefore in front of the ear. So the heel of my hand is on top of her, a little bit on her face and a little bit on the temples. And what I'm doing is I'm side bending it about 5 degrees to the left. Okay? And then I'm pulling traction. I'm imparting a very gentle traction, just pulling up to a natural stop point. So again, we put her in 5 degrees of left side bending. My contact is in front of the ears. Okay? She's in 5 degrees of side bending left, and then I do traction, and it's very small force. If you were to measure that on a force scale, like on a fish scale, it would be less than 15 pounds of force. And then what I do is I gently lift up with my right hand. So I'm doing little side bending oscillations. And I do 30 of those. Just very, very gentle while maintaining the traction. And I didn't count, but I certainly did at least 20 of those. So now my fingers are underneath the mastoid, and on the right side now I can lift up. Now movement goes through that joint, and the head side bends to the left a few degrees. Do you feel the difference in movement?
I do.
Good, good. Are you aware of anything else, any benefit from this?
Yeah, the headache is lifted.
Oh, sweet. So it helped your headache. Beautiful. Well, that's very nice. It's kind of a rare finding. Usually when the uppermost joint has a restriction, usually it also involves a rotational restriction. But I didn't find that. So it was, seemed to be only a side bending restriction, and that's what we treated, and it seemed to work. So I'll give you a link to this video, and again, your husband's name is Michael?
Jeremy.
Jeremy. All right. So if he could test you every day for a week.
Okay.
And treat you as needed, and then test you twice a week for several weeks, and eventually just test once a week.
Okay.
All right? Thanks very much.